work at the UC Berkeley School of Public Health in the Office of Diversity Services. And pretty much I'm here today to talk to you all about public health and hopefully answer questions that you may have. But really I want this workshop to be as helpful for all of you as possible. So if something I say doesn't make sense, or if I'm using acronyms that you're like, what is she talking about? Public health is full of acronyms, like so many acronyms. So I get kind of in the habit and I sometimes don't realize. So please, please, please just ask questions. I really just want this to be as helpful for you as possible. So thank you all for being here. A little bit about myself. So since you guys all shared, I will do the same and share. So this picture represents me because getting here was an extremely windy road. I wasn't sitting in undergrad, so I went to UCLA for undergrad. I was not sitting in my classroom in undergrad being like, oh, I'm going to go into public health, or oh, I'm going to work for UC Berkeley and work with students. Like, that is not what was on my mind. I entered UCLA as a pre-med student, and I wanted to help people, and I knew what medicine was, and I liked science relatively, and so those were kind of all the reasons why I was like, medicine seems like a really good fit. As I went on in my trajectory at UCLA, medicine seemed like less and less of a good fit for kind of myself and what I wanted to do. Part of it were I didn't love my classes, so for you biochem majors, major props, and for all of you who love your science classes, that's great. I was not super thrilled with all of them, nor did I maybe perform excellently in all of them. I really wanted to help people though, like that was kind of there, and I just didn't know what other options I had. So I was kind of fumbling at UCLA, and an older student kind of was like, hey Duran, check out public health, I think you might like it. And so I, on a whim, took a class in community health sciences, and in that class I kind of learned all about public health and how public health is really focused on prevention as opposed to treatment, which is kind of how a lot of other health disciplines, what their focus is. And public health really looked at population, so working with entire groups of people. And I was like, oh, that's great too, so I still get to work with people. And public health was really committed to looking at health disparities and working with communities that don't necessarily always get #1 priority status in the US. And so that was something that really spoke to me. So I immigrated to this country. I grew up in a community that was full of people who had immigrated to this country who were refugees, and that was kind of who I related to and who I wanted to then work for and serve. So in my community health class, when they started talking about health disparities and they started talking about people who don't have access to health care and all of the other things that being an immigrant to this community into this country can mean, I was like, oh, light bulb, like this is amazing, this is what I want to do. So from that moment on, I was like, okay, public health really is for me. That was the end of my junior year of college. So I was like, well, let's see what this is going to be. So my senior year, I was a psych major for undergrad. My senior year, I ended up picking up a minor in public health, and I, just to verify that I really liked it, and I did. And then afterwards, after undergrad, I was super exhausted, burnt out, was like, I am not going to school right now. So I'm originally from the Bay Area, as in where I grew up, and so I moved back up home and worked in Oakland for a nonprofit that did a lot of health education. And the health education work that organization did was really looking at providers, so doctors, nurses, dentists, and how do we develop training and curriculum that will help those providers be more culturally sensitive. So for any of you who are interested in medicine and nursing and dentistry, you're going to have to maintain your licensure for the rest of your lives. So that means you're going to have to take kind of units and courses, and every discipline is different for how many units over how many years, but you need to maintain that. And so I worked for an organization that helped providers maintain their licensure, but really looking at how do we serve the communities that need it the most? How do we serve our low-income communities in California? How do we serve our communities of color in California? Because those communities, unfortunately, have a higher burden of a lot of illness. And it's not because they choose to. That's kind of a narrative that is often seen, in that those communities choose to live unhealthy lives. In public health, a lot of resources have been gone to studying this, and it is definitely not the case that communities like that choose to. The community I grew up in didn't choose to be to have less access to fresh fruits and vegetables. They worked jobs that they got, and they lived in neighborhoods where they could afford to, and a lot of times those neighborhoods did not have a Whole Foods or a Safeway. They had liquor stores. So that's not a choice, right? That's circumstance. So public health is looking at those. What are those circumstances that affect people's health? How do we impact those circumstances so that everybody has a better shot, right? Health should be a human right. In this country, health is a privilege. So that is what got me into public health. After working for that organization for a few years, I decided it was time to go back and get another degree because I wasn't growing, I wasn't really learning anymore, and so I went back to Berkeley and I got my Master's of Public Health. And I got my Master's of Public Health in Epidemiology and Biostats, which I'll talk more about later, but it's pretty research-oriented. And I love research. I love the idea of asking questions and getting answers, but I'm very much, and hopefully you guys can tell this already, a people person. So I need to be able to work with people. While I was in my master's degree, I noticed that there were not that many students who looked like me, for sure, in the master's degree, but also that kind of understood what communities face in California, particularly. So there were not that many people of color. There were not that many people who'd been raised in single-parent households. So there are a lot of disparities just within the educational classroom, and that's kind of what led me to this position. So now I work for diversity services within the School of Public Health, and my goal, why I'm here, is to help students who may be interested in public health figure out A, if it is a good fit for you, and B, if that's what you want, how do we get you to a graduate program in public health? Because I know my community better than any expert who comes in, and you all know wherever you came from, whatever community that is, how you identify, you know that better than I do or anybody else that's external, right? So the idea is to have a public health workforce that looks like the communities in California. And so part of that is helping people get an education that want an education. So I work with an awesome team. I think some of you may have met Abby. She came to the conference last year and the year before. I think she was a keynote speaker one of those years. I can't remember which. But we also work with two current students, Victoria and Lila. And they're both current Masters of Public Health students. And all four of us work to help students figure out if public health is the right fit, how to apply to graduate school, how to write your essays, whatever questions you have. So just remember that we're here as a resource, and all of our contact information is on the back of this sheet. So for any of you who didn't grab it, it's up here, but it's on the back on the bottom. So now you guys know why I'm up here, why I care. And any questions thus far about anything I said or what I do? Cool. So Abby, Victoria and Lila, and myself. So what is public health, right? That's like the big question. That's probably the question that I get asked the most. And not just by students that I'm working with, but my family. They're like, what do you do? Like, please explain that to me again. I'm like, okay, let's try. But let's do what you guys have to say. What do you all think public health is, or what is it to you? And I will let you know that there's pretty much no wrong answer to this question, so you can say whatever you want. Mm-hmm. Perfect. Yeah, that's a great answer. So community health. So being a leader in your community, but access, right? The other thing you said. So a lot of people in this country we know don't have access, even though, Affordable Care Act passed, great stuff, but people still don't have access. So that is a part of public health. What else? Yeah, that's great. So vaccines, so like you said about flu prevention, vaccines, huge part of public health. Infectious disease and studying vaccinology, big part of public health. But disaster preparedness and kind of emergency situations. So Katrina, right, when Hurricane Katrina hit, that looking at how our country is or is not equipped to deal with those kinds of things, that's public health. Ebola, right? That was in the media all the time. People were talking about, people in the States were freaking out about it, which was largely unwarranted. That was a public health, A, issue, and B, response. Those are really good examples of public health. Maybe one more person? I can wait all day.
And when we think of public health, we always think about medicine, and it's not necessarily about going to the doctor, but it's also everything around environment. Do we have enough farmers markets? Everything else, not just medicine.
Yeah, that's great. So one thing that is really important that you said is environment. That is a huge part of public health, and not just like what we think about environment, but where you work, where you live, where you go to school. All of these things are impacting your health. Place-based health, that's kind of what we call this idea of where you live matters, is a huge part of public health. Does anyone know kind of what one number can predict your life expectancy? So life expectancy is like, on average, how long people are expected to live. And there's a number that can predict that. I saw your hand first. Yeah, so in the US, your zip code can predict, on average, I'm not saying you individually, but on average, how long you are expected to live. So the California Endowment, TCE, put out this huge public health campaign to kind of bring people to understand that that matters. So there's a website that you can go to. I want to say that it's like Healthy Lives Matter, but if you Google TCE, so the California Endowment, zip code, you should come up. It's a website where you can punch in your zip code and out pops the average life expectancy. So what do you guys think about that? Should I be able to type in my zip code and see how long I'm expected to live? No, because I already talked about how a lot of people don't necessarily choose where they live, right? They live where they can afford to live. So that is place-based health, and that's a huge part of public health. But those are all really, really great examples. So this is just a schematic that I sometimes use that kind of helps people figure out, right, what public health is, because one of my friends or coworkers, she always says public health is like tofu. Like it's really hard to describe, and you don't really know like how to describe it to someone else, but if you were to see it, you would know that that's what it was, hopefully with tofu. So she says that public health is like tofu. But one of the areas within public health is research. So why do people get sick when they get sick? Why do certain people get sick more than others? Looking into asking, how do we ask those questions? How do we design research studies to ask those questions? So I told you I did epidemiology and biostatistics as my master's, so that falls within the research realm. My master's thesis was looking at Asian American teens in California and depressive risk. So are there certain populations within Asian American teens? So I compared South Asian, Vietnamese, Korean, Chinese, and I'm forgetting one group amongst each other to see if a specific group within that was at higher risk for depression. So that's a research question within public health. Policy and advocacy. So that is a huge, huge part of public health. I mentioned earlier the Affordable Care Act, right? So that was a huge policy that was being pushed to try to help certain folks gain access to health insurance. Again, it's not perfect. It doesn't work for everybody, and there are a lot of consequences that are now coming out of the Affordable Care Act that people didn't anticipate, but that's an example of public health policy. And then programs. So you mentioned farmers markets. So there are a lot of organizations that work to try to get farmers markets in communities where maybe the closest produce is at the liquor store, which probably isn't the freshest. So that's an aspect of public health, and that kind of goes under the program realm. So if people go into all of these different areas, and there's definitely overlap in all of the areas too. So you don't have to just pick one. Any questions about that? Okay, and here's the definition for some of you who like words better than pictures. So public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. So it's really looking at prevention, and it's really looking at populations. But what I say public health is the 3 Ps. So prevention, populations, and personal. So that's kind of how I define public health. So the prevention piece. There's this kind of story that's told in public health often to kind of describe how public health operates, and it's in contrast to medicine or some of the other health fields. So the story goes like this. So there are 3 people and they're walking along a river, and they see a kid floating down the river who doesn't know how to swim. And the kid's like obviously struggling because the current has caught him and he can't swim and he's flailing and he's asking for help, and the 3 people are really freaked out and they run towards the river bank, and one of them jumps in to save the kid, and he's like working really hard to get the kid back to the side so that he won't be in the water anymore, and another kid goes by. And then he drops off this one kid and he goes after the other kid, and a 3rd kid goes by, and these kids are coming by and there's more kids than he can handle and that he can do anything about, and he's really struggling. So his 2 friends are like, what can we do? Like, why are there all these kids that are in the river that are drowning and don't have help? Like, we need to figure this out, so we need to go upstream. So they walk further up the stream, and they see a bunch of kids, and they're kind of stuck in like an area where there isn't that much of a current, and they're trying to get out, but they don't know how to swim. So the 2nd friend goes, and he goes into the river, and he's like, let me teach them how to swim, because if I teach them how to swim, then they're not going to get carried away by the current, and then my friend who's further downstream isn't going to be struggling to save them one by one. So he gets in, he starts teaching kids how to swim, but it's hard. Some of the kids know, some of the kids can learn fast, some of them can't, they're struggling, some accidentally get caught up in the current and still go downstream, and he's like, oh man, I really hope my friend that's down there can get them. So the 3rd friend is sitting on the, still dry, still on the bank, and then he's like, okay, well, I need to figure out what's really going on, so I need to go further upstream. So he walks further up the river, and he sees that there's a school bus that had an accident on a bridge, and the bridge broke, and the school bus fell in, and that's why all of these kids are in the river. And he's like, we need to fix that bridge, and we need to get the school bus out, because if that were the case, then there would be no kids in the river, and then they wouldn't need to necessarily learn how to swim, and my last friend wouldn't be trying to pull them out one by one. So that is a story that's told often in public health to kind of help show you where people operate in public health. So people operate downstream, so that first person, with treatment and saving individuals and working with people one by one. And that's kind of our traditional clinical model, right? With doctors and nurses, they're most of the part seeing people one by one, and also for the most part, it's after they've already gotten sick, after something has happened to them and they're coming into the clinic. Then there's kind of the health education, the education realm, where that person is trying to teach these folks how to swim. And so a lot of people are like, man, if people just knew how to eat better and how to exercise, they would be able to do those things. And so people put in a lot of energy to teach people how to lead healthier lives. And then there's the 3rd, where we're looking at kind of root causes and systems, and that bridge that's broken and that bus. And how do we fix that? Because if we fix that, there are no kids in the river in the first place. And so the thing is, you need all of these people operating at all of these levels. But what you have to do is figure out where you fit best, where you swim best. Are you best at the end where you're working, you get good treatment, you get good interaction with individuals? Do you really like the idea of education? Is education what, does it for you? Or do you really want to look at those systems changes and look at policy and look at how do we stop that bridge from breaking? Do people have questions about that analogy? So all of those areas are important and valued. You just have to figure out what makes the most sense for you. So public health is populations, right? That was my 2nd P. This is a student group, student, staff, faculty group at UC Berkeley that I'm a part of. It's the API Women's Circle. API stands for Asian Pacific Islander. And pretty much the reason that I show this picture is just to demonstrate that public health is really about community. So it's both about working with communities, but also being a community yourself. You're going to have much stronger impact if you know how to work with other people. And so that is a really large focus of public health. How do you work in teams? How do you work with policymakers, with lawyers, with doctors to implement change? So you need to understand how to navigate all of these different worlds. And public health doesn't necessarily do it well. We have a lot of room for improvement, a lot of growth. We don't tap into the private sector. We don't market ourselves well. So there is a lot of work that needs to be done, but really public health is both about serving populations and working with groups of people. So for those of you who like to work with people, this could be a really good fit. And lastly, public health is personal. So that's my mom. I love her, obviously. She's great. She raised me, and I am totally who I am because of who she is and who she raised me to be. But a lot of students who come into our program, they come for very personal reasons. So things that they've seen in their community, in their family, whatever it may be. But that's kind of what has got them wondering, why does this happen? Why does this happen to my family, to my community, whatever it may be? So I told you I wasn't born here. We immigrated here. And my mom, and you can see from this picture, she loves wearing Indian clothes. And I remember this time when I was really little. I don't remember how old I was, but my mom got really sick until we had to go to the doctor. And we were very blessed and lucky that we had health insurance, so we got to go to the doctor and didn't have to worry about that piece of it. So we go to the doctor, and my mom speaks English too. We're from Bombay, and they teach English in schools in Bombay, so my whole family speaks English. But we go to the doctor in the emergency room, and we're waiting in the little room for the doctor. And he walks in, and he doesn't look at us, and he's like, does she speak English? And so both of my mom and I are standing there, we're like, huh. So we don't know who he's talking to because he hasn't looked at us. And I'm standing there being like, why does he wonder if my mom speaks English? Of course she speaks English. And my mom's like, why does he care if my daughter speaks English? Like, I'm here to see him. Like, it doesn't matter if she speaks English. So neither of us say anything. And we're both just silent. We're like, we don't know who he's talking to. And then he asks again. He's like, does she speak English? This is back before electronic records. So he's not looking at us. He's just looking at the chart. And so my mom's like, she just answers. She's like, yeah, she speaks English. And then he's like, oh, you speak English. And my mom was like, yeah, I do. And it was just this really weird interaction. And maybe you guys have had those kinds of interactions too, where people assume a whole lot of stuff about you before even asking you anything. So that person, that doctor, whatever, I don't know what he assumed, or I don't know why maybe it was my mom's name, maybe it was the way she was dressed, who knows. But he made assumptions about my mother that affected how he interacted with us, right? And I just don't think that should be the case. It is the case, obviously, but public health cares about that. They care about why those things happen and why people receive very different treatment depending on what they look like and where they go seek their treatment. And so I always think about that story, and obviously I was like 6. I had no idea what public health was. Like, I had no idea that memory would even stick in my head. I have the worst memory, but that one is really in there. And I think about it now, and I'm like, wow, there are so many opportunities to help people get better care. And whether that means helping people speak multiple languages, helping people understand different cultures, whatever that may be, but there are opportunities to enhance their care, and public health wants to enhance their care. So now I'm going to go into all the different areas within public health, because that's another thing. Hopefully you all have kind of an understanding of what public health is, broad strokes. Does anyone have questions about anything that I said or the examples? Y'all are so quiet. No questions? Okay, so when you apply to public health programs, if you go into public health, there's master's level degrees, there's doctoral level degrees. But whatever program you apply to, you have to pick a concentration. So you have to pick a major, essentially, to declare. So the first one, biostats, looks at development and application of techniques to improve the understanding of data that are relevant to issues in health, medical, and biological sciences. So really, the biostatistician is looking at how do I take data and answer the question that someone else has proposed. So it's not necessarily you asking the question. As a biostatistician, what you're really doing is manipulating data, figuring out how do we use statistical tests and statistical models to answer these questions. So like I told you guys earlier, right, I did my master's thesis on Asian American teenagers and depressive risk across different Asian American subgroups. And I needed to figure out what statistical models I could use to analyze that data, what kind of, what are the strengths of the models, what are the weaknesses, how to manipulate data to answer that question. So do any of you really like research or data? One person? Thank you for maybe humoring me and raising your hand just for that. So this could potentially be a good area for you, right? Because you're figuring out how to use that data. And the thing that I've learned in my years in the program and out is that you can really get data to say whatever you want it to. It may not be scientifically sound. You may be totally bogus in how you're going about it, but you can manipulate data in any way. So this is a really useful skill because you, as a biostatistician, will be able to understand if someone else's data is totally bogus or if it's valid. So that's just my pitch for biostats. Environmental health sciences focuses on the quantitative evaluation of the physical, chemical, and biological agents in the community and workplace. So a lot of this is about that place-based health, right, that I talked about. Health, place matters, where you work, where you live, where you go to school, all of that matters. Does anyone know what that is? Yeah. It is a refinery. It's the Chevron refinery in Richmond, which is 15 minutes north of Berkeley, so where I am from and where I live. And growing up, the mosque that I went to was in Richmond. So the Chevron refinery is really interesting because, as you can see, it produces a lot of pollution. And it emits this pollution into the air, which guess who breathes most often? People who live in Richmond. What do you guys know about Richmond? Do you know anything about Richmond? What do you know? Anything else about Richmond? No. Okay, yeah. So it is a very underserved community, largely African American, a lot of refugee populations though, so a lot of recent immigrants. Yeah, it has a lot of the issues that we find in a lot of underserved communities, so that go hand in hand, not great schools, a lot of violence, people looking for jobs, all of those kinds of things. And on top of that, there's a refinery that is producing a ton of chemicals every single day. So guess what that means for the kids of Richmond? They have higher asthma rates than, I'm pretty sure, any other child group in a city in California, but also one of the highest in the country. So what do you think would be maybe a public health solution to the refinery? Okay, relocating the refinery, maybe shutting down the refinery. So that is, right, that would maybe address the pollution problem, right? Because now we don't have those children exposed to all those chemicals that are contributing to their asthma. What comes with that, though, would be taking away a lot of jobs. So largely the community of Richmond is employed by this refinery, right? So that brings some economic stability to the area. So you can't just close the factory, you can't just move it out, because that literally eliminates thousands of jobs in a community that is already looking for jobs. So this is where public health gets tricky, right? So there is not a clear-cut solution. There are public health researchers at our school that are working with the community members, and B, people who represent the refinery to figure out what is the solution. So a lot of the solutions look at kind of limiting the pollutants, regulating, right? So that policy piece, so regulating what is emitted and how much is emitted. Also the education piece, so letting people know how they can, what kind of protective gear and stuff they can wear to not be exposed to chemicals. Where schools are built, are they built right next to the refinery? Probably not a great idea. So kind of looking at all of these systems changes, because you can't, unfortunately, just pull the refinery out. Because if it gets placed somewhere else, those kids are going to have asthma too. So this is kind of some of the tough stuff about public health. It's not black and white in that way. A lot of it is gray. A lot of it is trying things and making mistakes. But it's really great because it's challenging in that way. And this is where that whole cross-collaboration, that interdisciplinary work comes in handy, because you need to be able to talk to people all across the board. Epidemiology. So studies the factors that determine the distribution of health and illness in human populations. So can you all see this, the map of Oakland? So each of these things is a different kind of neighborhood within Oakland. And like we already mentioned, right, zip code determines how long you live. So these places have different zip codes, and guess what? They have different life expectancies. So the biggest life expectancy between two neighborhoods in Oakland is 14 years. So that's not like chump change, right? That's not like 6 months average. That's someone in Oakland Hills is going to, on average, live 14 years. That's what, 8th grader? Longer than someone in a different part of Oakland. A, that's not right, just I don't know how else to say it. But B, what can be done about this, right? So an epidemiologist posed that question and went about figuring out, how do we get data to answer this question? So how do we as people who live in the community understand that, yeah, people in Oakland Hills are gonna have a way different type of quality and length of life, but you need data to be able to make the argument to other people who don't necessarily care as much. And so an epidemiologist went and did this work. So that's what you could do if you became an epidemiologist. A lot of it is research-based. So a lot of it is, what is the question that I have? How can I ask the question? What kind of data exists? How can that data help me answer the question? You work very closely with the biostatistician. But another aspect of epidemiology too is working with community members so that they can establish what questions you're asking. So why should I go into some other place and be like, oh, I want to know this? Like, they probably have their own questions that they want answered about their own health, so they should determine the questions. I may come with the statistical knowledge and figure out how to make the data work, but I shouldn't really be the one asking a question about someone else's community. So part of that is working with communities. Health and social behavior, so analyzes the social, cultural, and biobehavioral determinants of health and health behavior. Students are trained on how to design, implement, and evaluate interventions and policies aimed at improving community and population health. So a lot of other schools call this community health or health education. Does anyone know what that is a picture of? What do those people look like they're doing? There we go, protest, striking. Okay, that's the only answer I was going for. So this is a photo of a protest of something SoCal relevant. So in Santa Ana, there's all of this business about gang injunction. How many of you, any of you from Santa Ana? Okay. So one of my colleagues who went through the master's program is working on a health impact assessment about this gang injunction. So pretty much what this gang injunction does is makes it illegal, more or less, for people who are or have ever been associated with a gang to be seen together in public. So I'm in a gang, you're in a gang, maybe we haven't been active in a really long time, but we both get caught at the grocery store together, and guess what, we can both be in jail. So imagine what this does for community ties, for racial profiling, right? It essentially allows people to legally racially profile, which affects communities of color more than not. So there are a lot of people who are up in arms about this gang injunction, understandably so. Clearly I'm really biased. But what my friend is doing that's working for this community is figuring out what are kind of the objective data that can go to support that this is going to have negative impacts on health. This is going to be a problem for this community in these ways, in their health. And so that's something that you can do with the Masters of Public Health if you go into working in health impact assessments. And it's just it's a very current example. It's what he's currently doing. But there's all sorts of policies and legislation that's being passed that is going to have health outcomes and impacts, but people aren't really asking that question. So you would have the tools or skill set to do that kind of work. Health policy and management trains students to conduct research, disseminates knowledge to advance the organization, financing, and delivery of health and medical services. So a lot of people kind of think about this as public health because they think of health access, they think of health insurance, they think of hospitals as public health. So a lot of people who work at hospitals, who work for health insurance companies, the whole Affordable Care Act was a huge health policy that was largely a result of people who have their MPH with this focus. And I'm going to skip over the example to make sure we get to other stuff. So I'm also going to skip this part. That's okay with you. And I'm going to talk about careers because that's another question I get often. They're like, Duran, I like what you're saying. This is great. I want to do this. But what does that mean? Like, how am I going to pay the bills? Which is a totally 100% reasonable question for you to ask. So this website is a tool that can help you. Pretty much it's a slot machine, which is really weird. But what it does is it lets you choose different parts of public health. So you can choose your specialty, right? I just went through 5 of the core areas of public health. And you can, if one of those maybe spoke to you more, you can select that one. You can select what kind of place of employment you might want to have. Do you want to work at a nonprofit like I used to do? Do you want to work at a hospital? You said you wanted to work at the county. And then you can pick the region of the United States. So let's say you want to stay on the West Coast because it's awesome. So you select those things, and then you hit the little thing on the slot machine, and then out pops a profile. So it's a real person who's doing a real job. It talks about what their job responsibilities are, how long they've been doing it, how much money they make. So it's just a tool that's helpful for exploring options is what it is. The other option or the other resource that I have for you is 101 Careers in Public Health. It's by Beth Seltzer. I don't even know what I'm doing with this. So it's just a book that has a bunch of different public health careers. It's great. I perused through it. It divides them into those same kind of concentration areas that I talked about earlier. But it also divides them into topic areas. So let's say you're really interested in working with the Latino community. So it has jobs in there that are specific to that. Let's say you're really interested in working with people who are affected by HIV or AIDS. So it's going to have jobs specific to that. So it divides it in a bunch of different ways. It's a great book, and it's not that expensive on Amazon. Questions about careers? So the reason I'm not going into like every single example is, as you can imagine, that would be like a never-ending presentation. So instead, I'd like to connect you with resources so you can explore the careers on your own. But I did give you some examples of what people at our school are doing earlier. So getting into graduate school is another part, right? So let's say I've sold you on public health and now you're really excited, hopefully. Getting a master's degree in public health is going to allow you to do the work that I talked about. So what do you need? So you need a strong application. Having a well put together application where you put in effort will show. It will show to the admissions committee. It will show to everybody. So that means giving yourself enough time to do a really good job. Don't rush it. Don't wait until, so the application's due usually December 1st. Do not wait till Thanksgiving to start your application because I will have a heart attack and you will be really stressed out. So start plenty of months in advance. Make sure that you have everything in order, right? You do need to take the GRE, so Graduate Record Examination. It's a standardized test. It's really similar to the SAT. Anything above the 50th percentile makes me sigh relief. So if you're under the 50th percentile, please take it again. But this is part of that being prepared, right? Giving yourself enough time to retake the test, that's huge. Transcripts, so you can have any major, which is great. So some of you are already majoring in public health, but some of you biochem, bio, but even way non-science majors. So women's studies, gender studies, Chicano studies, any of that, you could still get your master's in public health. We don't care what you major in. What we care about is how well you do in your major. So your GPA does matter. It's, again, not everything, but it does matter. And anything above a 3.0 would be great. And that's only looking at your last 2 years of coursework. So we see all your transcript, but when we calculate GPA, we look at your 3rd and 4th year or your 4th and 5th year. Letters of recommendation, you need 3. It should be a mixture of professors and professional references. So most students who come to our school work before they come. So a year, 2 years, 5 years, whatever, they work. So having a supervisor be able to talk about the kind of public health professional you are is really important, as well as having a professor be able to talk about your academic abilities. And the real life experience, that's what that comes in, so that work experience. So stuff counts in undergrad too. Internships, working while you're in school, all of that stuff counts. But people also do, our school or admissions committee really does want to see full-time work experience, which is after, for the most part, undergrad. And all of that real life experience is going to make you a strong applicant because you're going to be able to write about why you love public health in your essays. And your essays are a really important part. So here's a list of some internships. Yeah, it's just a list, so if you guys want to write some of them down. There's a lot of different public health internships. These are just some that I know students have done that they've really liked, so I feel comfortable sharing them because I'm not setting you up for having a terrible experience. But really anything can be public health experience. I think I already talked, like you guys can tell from what I've talked about that it is so broad and there are so many different areas of public health. You just have to craft why that's relevant to your application. And if you are having a hard time crafting, that's where I come in handy. I can help you with that. I can help you figure out how do you take all of these different things and turn it into one cohesive argument for why you are an awesome person for us to have at our school. So I told you most people take time off after undergrad to work. These are some of the things they do, but again, you could really do anything. Just again, have it be something that you care about and that you like. And lastly, here is the contact information. So Abby's email address, Victoria and Lila, like I said, they're current students in the master's program, and then myself. Please email me. Oh, I have business cards that I didn't put out. If you have any questions, if something I said didn't make sense and you would rather email me than ask, that's fine. I'm gonna put the business cards there. But yeah, I think we have no time, I think. I don't know actually what time this workshop ends. But if you have questions, I'm here for a little bit. Thanks.